Hi, my name is Cadence, and today for my teaching video, I've decided to do hypertrophic obstructive cardiomyopathy, also known as HOCM. And today, for time purposes, I'm just going to refer to it as HOCM. And also for visual aid, I've decided to label the heart. And then this is a normal heart, and then I will then show you and get into what happens whenever this disorder affects the heart. But really we're just going to be focusing on the blue and yellow. I will mention other parts and I will show you like how they are incorporated into this. But yeah, we're going to do it all together and I hope you learned something. So I'm going to jump into just how the normal heart functions, and then I'm going to get into what happens with the disorder, and followed by the symptoms, prognosis, and also the treatment for this disorder. So in a normal heart though, the left ventricle, which is the blue, it's going to relax during diastole, and it fills with blood during this. And then in systole, it's going to contract and push blood through the aortic valve, which is right here, so it's going to push all the blood up. The outflow tract is normally wide open during this, and the mitral valve often just stays out of the way, just so blood can move forward smoothly. A healthy heart is going to need both really good contraction and also really good relaxation in order to fill and eject blood efficiently, in order to be considered a healthy heart. In HOCM, most cases are going to be inherited mutations within the heart's contractile proteins. These abnormal sarcomeres, they make the muscle contract too forcefully, and over time the heart muscle cells enlarge and become disorganized, very disorganized. The most dramatic thickening that happens is in the intraventricular septum, which is this yellow right here. So this is a normal heart. This is exactly how it functions. And then this is what happens whenever a heart has HOCM. And as you can see, this septum is just completely engulfing the left ventricle. So with this, that thick septum bulges into the pathway where blood should be exiting out, and then this creates obstruction. As the ventricle contracts, a suction-like force can pull the front leaflet of the mitral valve forward towards the septum. This is called systolic anterior motion, and it narrows the outflow tract even more and sometimes causes blood to leak backwards into the atrium. So these changes really create three major problems. First, it's that blood has a hard time leaving the heart. So the left ventricle has to generate very high pressures to help push that blood out. Second, the thick, stiff ventricle has a hard time relaxing. So as you can see, this is completely healthy, and then this is what it looks like during this. So it just has a very hard time relaxing, so it feels very poorly. And then the third is the enlarged and disorganized muscles. They increase oxygen demand, and it disrupts a lot of the electrical signals, leading to what we feel is like the chest pain and also arrhythmia risks. So because of this, patients are going to typically notice shortness of breath with activity, the chest discomfort, or episodes of dizziness, and also fainting, especially during exertion. Some are going to feel palpitations from arrhythmias, and also like on exam, a harsh systolic murmur can be heard, and it gets louder when preload drops. Like this is like whenever someone performs a Valsalva maneuver, because a smaller ventricle makes the obstruction worse. Diagnosis is typically made within a cardiogram, which is clearly going to show the thickened septum and the systolic anterior motion of the mitral valve, which is right here. In ECG, may show signs of the left ventricular hypertrophy, and an MRI can help reveal the scarrings. And whenever someone is diagnosed with this, genetic testing can help identify affected family members, just for like safety precautions, just to see like, because it is a genetic mutation. So with that, or an inherited mutation. So the outlooks really do vary with this the disorder. Many can live like a fairly normal life with treatment, and then others are at risk of heart failure or dangerous arrhythmias, including rare cases of sudden cardiac arrest. Treatments focus on reducing obstruction and protecting the patient. Medications like beta blockers and certain calcium channel blockers slow the heart rate and help reduce the force of contraction, which help improve filling and like decreasing the obstruction. And then disopyramide may be added when symptoms continue to progress and continue on. If medications aren't enough to help with this disorder, the thickened part of the septum, this can actually be surgically removed in a procedure called septal myectomy, or it can be intentionally shrunk using alcohol septal ablation. For people at high risk of sudden death, such as those like with a severe thickening, fainting episodes, or a strong family history, an implantable cardioverter defibrillator, that's going to be like your best friend. That's going to be the one that that doctors are going to recommend. But in all, HOCM is a genetic disorder that thickens and stiffens the heart. It blocks blood flow and increases arrhythmia risks. With early detection and proper treatment, many patients can do very well and have a very fulfilling life. Thank you so much for listening. I hope you learned something, and I'm so sorry for my stutter. Have a good day.